Okay, my name is Jennifer Kramer, and I work at the Michael E. DeBakey VA Medical Center in Baylor College of Medicine in Houston, Texas. We conducted a retrospective cohort study to examine the effect of HCV treatment on the risk of HCC in patients with hepatitis C in a national cohort of veterans in the United States. To do this study, we used the Clinical Case Registry, which is a VA administrative database that contains laboratory, pharmacy, and ICD-9 diagnosis code information on all patients with hepatitis C in the VA system. We define treatment as having more than one prescription for pegylated interferon in combination with ribavirin, and the first prescription had to occur before September 30th, 2005. We followed up their data to see if they achieved an SVR. We defined an SVR as having all negative RNA tests, including one negative RNA test more than 12 weeks after the treatment completion date. Our outcome was HCC, time to HCC from the HCV index date, and we defined HCC as the presence of an ICD-9 code, which we have previously validated in previous work. We conducted this analysis in a cohort of all patients with chronic hepatitis C, and we also looked at a subgroup of patients with an ICD-9 code for cirrhosis. The ICD-9 code for cirrhosis has also been validated in prior work. We identified over 123,000 patients with hepatitis C who utilized the VA for their health care. Their mean age was 50 years old, the majority was white, and 97% were male. 13.2% of these patients had cirrhosis. We conducted a Cox proportional hazard multivariate model controlling for demographics and other confounders. We found that patients who achieved an SVR were 71% less likely to progress to HCC than patients who received no treatment. When we looked at the group of patients who had received treatment but did not achieve an SVR, we found that there was no difference. In the cirrhosis cohort, we found a similar finding that patients who had treatment and an SVR were 66% less likely to progress to HCC compared to patients who received no treatment. However, unlike the entire cohort, in our cirrhosis cohort, we found that patients who received treatment but did not have an SVR had a slight risk reduction in achieving HCC. In conclusion, HCV treatment with pegylated interferon and ribavirin was strongly associated with a reduced risk for HCC in a national cohort of veterans in the United States. HCV-infected persons should be identified and counseled on antiviral treatment, emphasizing the long-term benefits.